And I believe that health care is a human right, entitled, that all people are entitled to health care. It is not just a privilege for the wealthy. Number two, everybody understands that when we talk about the crisis in health care, we are also talking about the crisis of the high cost of prescription drugs. Once again, here in the United States, at a time when the pharmaceutical industry are making tens and tens of billions of dollars in profits every single year, we pay, again, by far the highest prices in the world for the medicine that we use. And the result of that, believe it or not, is that 1 out of 5 Americans who leaves a doctor's office with a prescription cannot afford to fill that prescription. That's nuts. So right now, despite the gains of the Affordable Care Act, where some 20 million more people now have insurance, we still have 28 million people who have no health insurance. So it seems to me pretty clearly that our job as a government is to guarantee health care to all people in a cost-effective way, to take on the pharmaceutical industry, and to lower the cost of prescription drugs. Unfortunately, the legislation that is supported by Representative Price, who is Mr. Trump's nominee to be head of HHS, would increase by 18 million the number of uninsured Americans the first year that his plan would be implemented. If Mr. Trump is serious about taking on pharma, if Mr. Trump is serious about having Medicare do what every other government around the world does, and that is to negotiate prescription drug prices with the pharmaceutical industry, we are going to have very shortly very significant legislation to do just that. And I would hope that Mr. Trump would join us and support that legislation. I've got to get going. Thank you all very much.